Welcome to Pediatrics for Mothers YouTube channel, the channel dedicated to helping moms navigate the exciting, but the often overwhelming world of raising children. Our mission is to provide informative and engaging content on topics related to child health, development, and parenting. If you're interested in learning more about child health and parenting, we invite you to subscribe to our channel. By subscribing, you'll never miss an episode of our informative and entertaining content. And if you find our videos helpful, please like and comment to let us know. We always appreciate feedback from our viewers, and we're always looking for new ideas for future videos. Thank you for joining us on this journey, and we look forward to sharing our knowledge with you.
Bronchiolitis in children. Bronchiolitis is a common viral respiratory illness that affects infants and young children, particularly during the winter months. It is caused by a variety of viruses, with respiratory syncytial virus, RSV, being the most common. Pediatric bronchiolitis is a significant cause of hospitalization and morbidity among infants, particularly those under the age of 6 months. This essay will provide an overview of pediatric bronchiolitis, including its etiology, pathophysiology, clinical features, diagnosis, treatment, and prevention. Etiology. Pediatric bronchiolitis is a viral respiratory illness that primarily affects the lower respiratory tract. Several viruses can cause bronchiolitis, including RSV, human metapneumovirus, HMPV, parainfluenza virus, PIV, influenza virus, adenovirus, and rhinovirus. RSV is the most common cause of bronchiolitis, accounting for up to 80% of cases during the winter months. Pathophysiology. Bronchiolitis occurs when the small airways in the lungs, known as bronchioles, become inflamed and narrowed due to the viral infection. The inflammation and swelling of the bronchioles lead to airway obstruction, increased resistance to airflow, and impaired gas exchange. This results in symptoms such as coughing, wheezing, and difficulty breathing. Clinical features. The illness typically begins with symptoms similar to a cold, including nasal congestion, runny nose, and mild fever. As the infection progresses, it can cause inflammation and obstruction of the bronchioles, resulting in more severe symptoms. The following are common signs and symptoms of pediatric bronchiolitis. The following are common signs and symptoms of pediatric bronchiolitis. 1. Coughing. A persistent, hacking cough is a common symptom of bronchiolitis. The cough may be dry or produce phlegm. 2. Wheezing. Wheezing is a high-pitched whistling sound that occurs when air flows through narrowed airways. It is a hallmark symptom of bronchiolitis. 3. Rapid or difficult breathing. Children with bronchiolitis may breathe rapidly or have difficulty breathing due to the obstruction of the airways. 4. Cyanosis. Cyanosis is a bluish discoloration of the skin or lips, which can occur when the body is not getting enough oxygen. This is a serious symptom that requires immediate medical attention. 5. Poor feeding or decreased appetite. Infants with bronchiolitis may have difficulty feeding due to breathing difficulties. 6. Fatigue. Children with bronchiolitis may be more fatigued than usual due to the increased respiratory effort required to breathe. 7. Fever. While fever is a common symptom of bronchiolitis, it is usually low-grade and lasts only a few days. It is important to note that the severity of symptoms can vary widely from child to child. In some cases, the symptoms may be mild and resolve on their own, while in other cases, the symptoms may be severe and require hospitalization. Additionally, young infants, Premature infants, and children with underlying medical conditions are at a higher risk for developing severe symptoms and complications from bronchiolitis. Parents should seek medical attention if their child exhibits any of the above symptoms or if they are concerned about their child's health. Diagnosis. The diagnosis of pediatric bronchiolitis is primarily based on clinical presentation and physical examination. Diagnostic tests such as chest radiography, blood tests, and viral cultures are typically not necessary unless the child is severely ill, has an underlying medical condition, or is not responding to treatment. If a viral culture is obtained, it can help identify the causative virus. Treatment. The treatment of pediatric bronchiolitis is primarily supportive, as there is no specific antiviral therapy for the illness. Supportive measures include oxygen therapy, hydration, and bronchodilators. Oxygen therapy is indicated in infants and children with hypoxemia, while hydration is essential to prevent dehydration due to increased respiratory effort. Bronchodilators such as albuterol may be used to relieve bronchospasm and improve airflow. In severe cases, mechanical ventilation may be necessary. In addition to supportive care measures, several chemical drugs may be used to treat pediatric bronchiolitis, depending on the severity of the illness and the symptoms present. 1. Corticosteroids. These drugs are used to reduce inflammation in the airways and are usually reserved for severe cases of bronchiolitis. The use of corticosteroids in pediatric bronchiolitis remains controversial, as studies have shown conflicting results regarding their effectiveness. 2. Antiviral drugs. There are currently no specific antiviral drugs approved for the treatment of bronchiolitis. However, in severe cases, certain antiviral drugs may be used off-label, such as ribavirin, which has been shown to reduce the severity of RSV infections. 3. Antibiotics. Antibiotics are not effective against viral infections such as bronchiolitis. However, they may be prescribed if a secondary bacterial infection is suspected. 4. Nebulized saline. Nebulized saline may be used to help thin mucus secretions in the airways, making it easier for the child to breathe. Home remedies. In addition to chemical drugs, several home remedies may help relieve symptoms of pediatric bronchiolitis. These include: 1. Steam therapy. Breathing in steam from a humidifier or hot shower can help loosen mucus and relieve congestion. 2. Nasal saline drops. Saline drops can help moisturize the nasal passages and clear mucus. 3. Rest. Rest is essential for the body to heal and recover from illness. 4. Hydration. Drinking fluids can help prevent dehydration due to increased respiratory effort. 5. Elevating the head. Elevating the head of the bed or using pillows to prop up the child's head can help relieve coughing and congestion. It is important to note that home remedies should not replace medical treatment, and parents should always consult with their child's health care provider before using any home remedies. Additionally, if a child's symptoms worsen or do not improve after several days, medical attention should be sought. Prevention. Prevention of pediatric bronchiolitis is essential, as the illness can be severe, particularly in infants and young children. The following are some preventive measures that can be taken to reduce the risk of bronchiolitis. 1. Vaccination. There is currently no vaccine available for bronchiolitis, but vaccination against the respiratory syncytial virus, RSV, which is the most common cause of bronchiolitis, may reduce the severity of the illness. Infants and young children who are at high risk of severe RSV infections may receive monthly injections of a monoclonal antibody called palivizumab during the RSV season. 2. Hand hygiene. Good hand hygiene is essential in preventing the spread of respiratory viruses, including RSV. Parents and caregivers should wash their hands frequently with soap and water or use hand sanitizer, particularly before and after caring for a sick child. 3. Avoiding contact with sick individuals. Children who are sick with a respiratory illness should be kept away from others, particularly infants and young children who are at a higher risk of severe illness. 4. Breastfeeding. Breastfeeding has been shown to reduce the risk of respiratory infections in infants, including bronchiolitis. 5. Avoiding exposure to secondhand smoke. Exposure to secondhand smoke has been shown to increase the risk of respiratory infections, including bronchiolitis. Parents should avoid smoking around their children and keep their home smoke-free. 6. Proper cleaning and disinfection. Proper cleaning and disinfection of surfaces, particularly in areas where children congregate, can help prevent the spread of respiratory viruses. It is important to note that while these preventive measures can reduce the risk of bronchiolitis, they cannot guarantee complete prevention. Additionally, parents should be aware of the signs and symptoms of bronchiolitis and seek medical attention if their child exhibits any concerning symptoms. Conclusion: Pediatric bronchiolitis is a common viral respiratory illness that affects infants and young children. It is primarily caused by RSV and is characterized by inflammation and narrowing of the bronchioles, leading to airway obstruction and impaired gas exchange. The clinical presentation ranges from mild to severe, with supportive care being the primary treatment. Prophylactic measures such as hand hygiene, isolation precautions, and vaccination are essential in the prevention.